And he says nobody, including myself, is free from Sura, because the primary Sura is the basic property of all living people, which is discernible uh, by the susceptibility and the sensitivity. So the life itself is manifestation of primary Sura, because it is based on the susceptibility and sensitivity as part of living property. I'm seen in the children garden what we call the what do you call what do you call इसको क्या बोलते हैं इसको ladder and क्या है so the child climbs up to the top. From here to here, from the base to the top, primary Sura, nothing happens. And when this primary Sura is tinkered with by our attempt or our intervention, it goes into secondary Sura. And the secondary Sura is the point of no return. And if the family has psychosis or tuberculosis or syphilis, the disease will travel either to the psychosis, tuberculosis, or whole hog to the syphilis. This is how the whole thing takes place. Till the point of no return, body is able to bring back normalcy. Beyond that, if you go, then you have to have the corresponding antipsychotic, anti-tubercular, and anti-syphilitic or anti-miasmatic remedy, and it's only salvage. Okay. Now, Hahnemann says that miasms are like infection. They get inoculated in the system. Over a period of time, they multiply in the system. We call incubation. And their first appearance or first manifestation is at the periphery. So the initial manifestation is at the periphery, the less important organ, and not in the center. So disease travels from less important organ to most vital important organ. And therefore, the cure has to take place in the reverse order. From more vital organs are to be freed first, and then take care of the peripheral less important organ. The centripetal direction and the centrifugal direction. This man, this great soul, Dr. Constantine Herring, has given us a yardstick, measurement, a tape by which we can find out whether we are taking the right course, or we are going in the right direction, or we are not going into the right direction. And his contribution is a great help in prognosticating the onward march of the chronic disease. Dr. Constantine Herring. And what he has given is the Herring's law of direction of cure. First to appear, being last to disappear. The disease, the rational treatment of the disease has to be from syphilis to tubercular, from tubercular to psychosis, and psychosis to Sura. Only if you go from here to here, then only you can say that you have rationally cured completely, rapidly, gently, without leaving any trace of the disease. That is what Hahnemann's tall order for all homeopaths who want to do the management part. All right. Another great soul was Dr. James Tyler Kent. He was responsible for contributing the role of mind in evolution of disease. And what he has described in his theory is mental age. Mind plays a vital role in chronic disease. And therefore, mental picture has to be taken into consideration. in our holy script, Gita, same thing has repeated. Brooding on the objects of senses, man develops attachment to them. And from this attachment comes the desire. The desires are unlimited. You feel more desire, more desire, more desire. And from desire, if they are not fulfilled, the anger sprouts and you become angry. That's what the in the Sankhya Yoga, the 63rd sloka, he says from anger proceed delusions. From delusion, confusion takes place. And a confused mind cannot have the rational reasoning. And this ruining of the reasoning leads to complete destruction of human being. This is what our Hindu philosophy says, and this is what Dr. Kent was very keen on telling us. So, with this background, I will come to the manifestation, how we identify these miasms in our body, both at the level of mind and at the level of body. I hope you are with me all together. This is primary sora. And how we recognize by the activities better than other people that this man is soaring. Hyperactivity and hypersensitivity. All activities, his mental and body are like a soldier, like a Sardar, like a Sikh, the highest noble man. Stimuli are there, they are bombarding, but then he is not getting ruffled. All right, this is the mind. This is the soric mind. Physiological processes are very rapid and heightened. The psycho-neuroendocrinal mechanisms are alert, they are active, they are responsive. There is acute mobilization of built-in defenses. Simple inflammation takes place and which is resolved very rapidly, and disposal is quick, and everything becomes normal without any formation of pus, without anything. It's a purely reversible disturbances at the level of functions. This is what is. These we will see in the skin, in the mucous membrane, and in the mind. The reaction to the environment are very quick, very sharp, alert, intense, and quick, sharp, oscillating, and changeable. But they come back to the normal. These manifestations are either in the form of eruptions or in the form of discharges. But if we them check them by the external agencies, either these eruptions or discharges, if we suppress them, and then if the system is having other miasm, then the whole disease process starts. All right? These lead to secondary sora. These are the organs which are affected, the skin and the mucous membrane and the mind. Primary sora when suppressed lead to secondary point of no return. If this man has to face the adverse stimuli from the outside, the activity becomes much higher and you get what is called as functional disturbances in the functions of faculty and in the processes. And it involves practically every part of the body. The glands, like liver, kidney, endocrine, prostate, lymph nodes, etc. There are metabolic and nutritional discharges, involvement of the respiratory system, involvement of the cardiovascular system, involvement of CNS system. It's the only functional level, nothing structural, nothing structural, only functional level, and all reversible, all reversible. Over a period of time, if things are not corrected properly, then incoordination develops, and if you have the psychosis, then it leads to more incoordination and disturbances. Now, what happens? This hypersensitivity and this for individualizing features in the body, like craving, aversion, reaction to the environment, and so many concomitant. These are the indication for our similar remedy, and they are not to be stopped. They are not to be patched up by any means. It's a criminal. All right. So these are responsible for all our craving, all our aversion, all our reactions to the environment, and all concomitant symptoms. They are guide for homeopathic prescribing. Over a period of time, these hyperactivities and hypersensitivity becomes, you can't put the car in a top gear all the time. Over a period of time, a stage comes when the system becomes inefficient, inadequate, and it starts functioning in a malfunction. All right? This causes further alteration in the susceptibility, and you have the wrong responses. Now, what is the soric mind? Soric mind is hypersensitive, exaggerated, and responsive. It is a very intuitive mind, very, very intelligent mind, quick to grasp. Sensory perceptions are good. The system is efficient and adequate memory store. They remember things, they can connect things, they can judge the people, they have even clairvoyance and also extrasensorial perception. But because of this, they fall in what is called Mayajal, vortex of desires. And if they are not met, they are not satisfied, then they become easily angered, they become sad. You have expression in the love and hate without any cause, any rhyme or reason. Attachment, they have a craving or have aversions, and they spin hopelessly in this Mayajal of the world. Desires are gratified, but then they generate more greed. And those which are not with, they are in the form of fancies, daydreaming, and fantasies, filled through all these subconscious mind. Altered susceptibility causes wrong responses, and this lead to wrong performance at the work, in behavior, in the community, in the public, and bodily function. All these disturbances takes place, and because of that, the person becomes anxious, and these anxious are anticipatory anxiety. They are at the beginning. They travel before undertaking any task, but once the task is performed, then all their anxiety dissolves, and they are come back to normal. So this is what is the soric mind. This is the soric mind. Now, if the system is loaded with the psychosis, if the system is stimulated and it is hypersensitive and it's responsive, what will happen? With the adverse stimuli bombarding all the time, what will happen? They will lead to complete disorientation. All right. The activity failed to arrest the disturbances. The body now says that what happened? My activities, my system which are working overtime, they are not able to arrest the disease. What I should do? So all activities and disturbances lead to what we call masterly inactivity in the psychosis. All the systems which were on the higher side suddenly drop and they become more negative. Right? Become more negative. There is loss of control. Plus, the stimulation is there, bombardment is there constantly. What will happen? You will have become inappropriate, inefficient, and aberrant immune responses. This is what happens in psychosis. It happens. These progressive inefficient metabolic adjustments fail. I'm sorry. Yes. Now, what happens? If that happens, you develop anemia, you develop weakness, you will develop fatigue. There is RES aberration. The self is not recognized as self, and this non self is invited inside the body. So you get a lot of infection, and the self is recognized as non self. The body starts attacking its own tissues, and you have what we call autoimmune disorders. This is what happens in the psychosis. The psychoneuroendocrinal and the reticuloendothelial system slow down, forcing metabolic processes and responses very erratic, wandering, sudden, intense, that results in cramps, colics, and asthmatic type of attacks or spasm in the biliary apparatus or in the genital tract or in the stomach or in the cardiovascular system and all that. All right. On the body side, this is happening. On the mind side, you have dullness. The mind which was sharp, which was alert in the psychotic, in the story, now in the psychosis becomes dull, slow. The registration is poor, memory is very poor, and there is anxiety, restlessness, and because of all this, the guilty feeling. Right? The guilt is very important in the psychotic manifestation. This lead to paranoid thinking, brooding, and hypochondriac. Brooding and hypochondriac. The anxiety of conscience is also troubles the patient in this phase. So, patient may come to us with these symptoms. You discern these symptoms, and now you think of psychotic drug. Or patient may come because of the physical ailment like anemia, weakness, which are on the left side. You will think so. Person can enter into your clinic with the psychotic symptom either from the physical or from the mental, right? And you have to, if you are alert and you are careful, you should be able to understand. What happens? Because of presence of psychotic load in the system, you have remote metastatic non-supporting inflammation. That means the inflammation neither it is healing nor it is progressing. It remains in the all mucous membrane become hyperactive and you have discharges, you have inflammation, you have congestion and whatnot. The adrenal cortex is also imbalanced, and you have now pigmentation in the skin, in the mucous membrane, both general and well. And the body is not as clean as God has gifted to a psoric child. You have now moles, nevi, liver spots, etc. This is how we diagnose. The low resistance to germs. So these normal bacilli, cocci, viruses which are normally in the environment suddenly start attacking you and you fall victim. The vaccination causes chronic inflammation of the skin and the mucous membrane. This is how we identify the psychotic being. The glands are indurated, the discharges become acrid, they become thick, they become green, they become yellowish. They are not washable, indelible, and their smell is very, very peculiar, very offensive. It can be sour, it can be fishy smelling, or it can be honeycomb. Right? All these can happen. This is how we become. Now, if the tubercular load is there in the system, then it makes further damage by mind and damage to the body. In the tubercular phase, the body, which is trying to bring back the normalcy, homeostasis, is a last attempt on the part of the body. In syphilis, the body does not make any attempt whatsoever to return to normal. It is impossible. This is last ditch attempt on the part of the body to return to normal, and that is tubercular responsible. But these responsible, they may appear similar to the psoric, but they are not psoric because the reserve capacity of the body is gone away, is totally lost, totally become abnormal. Right? Now, if the system in in this present situation has to face the continuous adverse circumstantial environment, then what happens? This indolent system and these constant, what you call, adverse stimuli lead to force mobilization of poor resources. So mobilization is there, activities is there, but poor resources to back up these activities. Okay? What is the result? Result is destruction. Result is destruction over a period of time, and syphilitic changes. The disease progresses towards the syphilitic, and syphilitic miasm is brought nearer. All right, the tubercular responses become stronger than the earlier, and this happens when you have a strong history of the tubercular base, or either in the background, or in the either in the form of past illnesses like primary complex, or in the family, uh, near family. All right. So what happens because of this? There is increased activity at all levels, both at the level of mind and at the level of uh, body. All right. But this activity cannot last for longer time because the debility sets in after some time. All right, because of the overstimulation of the RE system and the PNE system. Debility sets in. This is what happens in tubercular myel. Now, we'll talk about the tubercular mind. What is tubercular mind? We have seen the psoric mind, we have seen the psychotic mind. Now let's talk about tubercular mind. What is tubercular mind? Tubercular mind is very hypersensitive and hyperactive. Right? These are the what you call uh, people who shine in all fields, or not all, not tubercular patients shine, but most of the people in this myelum, when it is dominating, they are at peak of their career or peak of their achievement. All right, they have alert mind. They become Einstein. All don't become Einstein. All tubercular people don't become Einstein. Some people become what we call uh, heroes, vagabond, and devdas. They become devdas most of the time. The alert system is very active, recall and reference system is very quick. Their registration and their responses are very quick. Uh, they analyze very clearly. They have mirror image, sharp image, sharp mind, alert mind. Their identifications are very, very clear. They can see through you through and through, and sometimes even they have the clairvoyance. They are the best judges to be found in the judiciary. They have creative mind. They are imaginative mind. But 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 most of the time, will, the drive, and the motivations they lack, and they all don't become scientists. Some people become. Majority of them go into the dust condition. Okay? They fall short in practice. They develop frustrations. They develop disappointments. They get disillusioned very early, and therefore they have all the time insecurity and anxiety. They have imagination, so they have long, very many desires, and these desires are not fulfilled because of their poor performance. So they go into daydreaming, night dreaming, fancies, and fantasies. Okay? And they are very changeable. They travel from to places. They have what we call travel mania or mood swingings. They have spasmodic effects, got hysterical convulsions, they get tics, they grind teeth, they have epilepsy. Sexual neurasthenia develops and they will cause debility. All this happens and that leads to what we call somatization, and the body start failing. But the only thing they have is the hope. They are the people who change their doctors, although they know that they are suffering from irreversible changes, but they and try to find out the remedy. They go from one doctor to another and from second doctor to third. They are very hopeful. They are very optimistic till last, in spite of all odds. At the physical level, what happens? At the physical level, the catabolic activities, the destructive activities are more, and the constructive activities, the anabolic activities are very poor or zero. And there is poor assimilation and there is mania. Activation of endocrine and metabolic processes are abnormal. Excessive sweat status, hyperthermia, night sweat, loss of weight, emaciation, voracious appetite. In spite of eating well, they lose flesh, hyperdynamic circulation, palpitations, and abnormal circulation. Pigmentation of the skin, stimulation of the RE system leads to induration of glands, liver, spleen, lymph nodes, and the disease spread through involvement of lymphatics. The adenopathies develop and thymus trouble. The Hodgkin disease and the sarcoid disease are classical examples of tubercular manifestation. The diabetic syndrome, are the manifestation of tubercular miasm. There is loss of elastic tissue, there is premature graying of the hair, and a person looks aged. This 40 years old man looks like 80 years. The chronic inflammation of the skin and its appendages, mucous membranes, serous membrane, and easy suppuration develops. They are more vulnerable to viruses, bacteria, cocci, and parasites. All healing takes are postponed, they are delayed, and all healing takes place through fibrosis, scarring, and the shards sometimes break open and up. Right? The keloid formation, reopening of the keloids, etc., are the tubercular manifestation. The diabetes accelerates the acidosis develop, ketosis develops, and you have very poor recovery. Convalescent is protected recovery from acute diseases. From one acute disease, they go into second acute disease, second to the third, and they are not well since last practical illness. All right, and they have all reduced resistance to all infections. Poor localization at the primary site, primary complex dissemination or generalized inflammation takes place in the form of miliary tuberculosis, galloping tuberculosis, extrapulmonary tuberculosis involving the brain and the meninges, and even typhoid stages. All these are the signs of physical manifestation of tuberculosis. Recurrent infection produce local destruction. The responses, as I told you, ending in fibrosis, cavity formation, and they develop what we call hemorrhage. Calcification occurs, and all surgery becomes must in these cases if the rest of the body is to be protected. The induration lead to softening, abscess formation, sinus formation, fibrosis, scarring, puckering, and the discharges now are more bloody, more cheesy, more mucus, and they are sweetie. You will find all these manifestation in leprosy, actinosis, fungal, Hodgkin, sarcoidosis, pneumoconiosis, Charcot joint, calcification ligament, caries, etc. All right? They travel towards syphilitic phase. They are syphilitic phase. And if the syphilis load is present in the body, the disease progress into this stage. This is the last stage, long drawn out process of asthmatic disorder, which ends in syphilis, and it declares definite death. Right? Destruction at all level, at all over. This overstimulation exhausted system, if it is bombarded with adverse environmental inputs, there is loss of control, and it functioning at all level, both at the level of mind and at the level of body. And the responses are very, very erratic, disproportionate, and always towards the destruction. This is the picture of syphilis. If we have a history of evidence of clinical syphilis in the past or in the family, or have repeated history of abortion, miscarriages, stillbirth, neonatal birth, or fetal malformation, or congenital anomalies in the family or in the past, placenta previa, vesicular mole, toxemia of pregnancy, history of malignancy, history of ectopic organs, all suggest the presence of syphilitic miasm in the system. Progressive loss value of life in syphilis. There is a lack of discrimination, both intellectual at the level of intellectual and at the level of perception. They become once again animal. From we become animal. We become prey to the lower base elements in our emotion desire complex. People with syphilitic traits have anger, hate, paranoid ideas, violence, destruction of love object, including self and others. They become homicidal or suicidal in their nature. They have irrational hatred, maar dalo, jala do, etc. They have maniac psychosis, and they have imaginary revenge. Revenge as if without any cause. If you see all these manifestations, we will find in our politicians all these signs and symptoms of syphilitic miasms are present. They are, they are seeking pleasure in three W's: wine, women, and wealth. They are malicious, they are vindictive, they are deceitful, they are cunning, and they are criminal minded. Very vindictive. In psychosis, these elements are there, but at the functional level, they are not at the effective level. In syphilis, they are translated into action. There, they are only in the thinking space in psychosis, but here in syphilis, they actually do it. A syphilitic person may talk to you very nicely. You will not be able to make out whether he is normal or he is suffering from anything, any abnormal mental disorder. Goes inside the house, close himself, takes out a gun, and shoots himself, and that is the end of the. This is how they behave, they react. Or they take out the gun, go to the person's fellow, and shoot him. All right? They use violent language. They become abusive. They are cursing, swearing. I think our old Rishi Munis are also suffering from syphilis because they were giving curses and swearing. Patthar banja, तेरे को तेरा नाश हो जाए, etc. And possibly these are all syphilitic elements. They are having more moral depravity and profanity, absence of any least vestiges of conscience. They don't have any what you call pangs of conscience. They have criminal propensities. They have degeneracy. They are very schemy and they are plotting. They are manipulating people and manipulating circumstances for our nefarious purposes. Because of all this, they are also suffering from guilt and anguish and despair. And that's why they become very pious at that in the evening. All right, whole day they cut throat each other in their business, in their dealing. But in the evening, they will go to the temple, go to the mosque, go to Gurdwara, and worship as if they want to get rid of their papas which they have done during the day. This is a typical looks like. This hopeless despair arising out of extreme depression and anguish leads to impulses of suicide, despair of recovery, of religious salvation. They think that they have committed great sin which cannot be wiped out. They become pious. They start constructing temples and mosques and all that. They have sinned away their days of grace, and there is no pardoning for them. This is what is the mental image of syphilitic disease. All right? Anguish, acute anxiety, restlessness, urge to destroy, aggravation at night, cold application, mental faculties are perverted and paralyzed. All these are syphilitic symptoms. Thinking, decision, discrimination, judgment, perception, to the point of indifference, apathy, finally, the loss of will to survive. Right? The will to live or will to let other people live is lost, and therefore they become criminal and they become animal. What happened to the skin, hairs, and nails? You have non-itching eruptions. These eruptions are copper color eruptions. They itch only at night. The pustule, crack, fissure, ulceration, induration, acrid discharges, bloody, foul, sloughing, phagedina, gangrene, squamous cell carcinoma all come under syphilitic miasm, and you have to have a similar remedy in the anti-syphilitic domain. Early graying of hairs, alopecia, loss of elasticity of the skin, the scleroderma, where the skin adhere uh, to the underlying tissue, deformed nail, congenital and secondary syphilis like signs, all are syphilitic manifestation at the physical level. They are the specimen of pathology. No system is free from destruction. Ulceration with induration with acrid discharge, bloody, foul, sluggish, phagedina. Mucous and serous membranes are acute and chronic inflammation, acrid discharges, bloody discharges, foul necrosis, pieces of bones coming out, the cartilages are destroying, the necrosis of the small bones, the mastoid, like mastoid and the ear ossicles, they develop caries and all that. All these are and that's why you will find in such cases you have drugs like capsicum and the mouse, all that. So many. Toxemia and malignancy spreads, diphtheria-like membrane develops, secondary infection lead to suppurations. Cartilages, bones, periosteum, teeth all become necrotic, crippled, deformed, and ulcerated. Dental caries, before the teeth erupt in the children, you will have those small bones and not complete developing. Bone pains at night, more at night, leg pains particularly, emulated by cold application, emulated by movements, osteoporosis leading to spontaneous fractures and deformity, ulceration healed through fibrosis, deep scarring, puckering, pitted deform, acne vulgaris, etc. All these are signs of syphilitic miasm, require syphilitic drug. Reaction to vaccination, inoculation, corneal opacity, scarring, chronic inflammation of iris, unequal deformed pupil, or then degeneration, atrophy of the tissue organ leading to loss of function and faculty. Degeneration start at the cellular level, goes into vascular obliteration, endarteries, vascular ischemia leading to degeneration, atrophy, cellular damage, arteriosclerotic processes, atheromatous develop, plaque develop, and arteries and arterioles are totally destroyed, and you have all sorts of embolic phenomena. Cholesterol ester complication, hemorrhages, thrombi, embolic phenomena, aorta, coronary, renal, cerebral syndrome, vascular dilatation, generalized or localized aneurysm, loss of elastic tissue aggravated by tobacco and exertion. CVS is a fertile ground for syphilitic miasm, and because of that, the rest of the body, no part of the body is escape this thing. Right? The nerve, brain, spinal cord degeneration, atrophy, neuronal cells, and the axial cell and nuclear cell, myelin sheath, all are destroyed. Loss of motor sensory, what you call integrity, loss, the balances, posture, thinking, perception, memory, will, vision, hearing, smell, paralysis occur at all places because of ischemic and hemorrhagic disturbances, metabolic disturbances, hormonal imbalances in different. Not only that, they lead to defective genes and chromosome, and this lead to the disease passing on to the next generation. Autoimmune disorders, you in this miasm, premature degeneration, senility, neoplasma, chronic irritation, hormonal imbalance leading to inflammatory processes and malignant processes, precancerous state like leukoplegia, submucous fibrosis, atrophic gastritis, Plummer-Vinson syndrome, Paget disease of nipple, cirrhosis, valvus, and acanthosis nigrans, all are manifestations of syphilitic miasm. Fortunately, people having miasm do suffer because most of the time these miasms are in the dominant or hibernating. All are hibernating. It's only when the adverse stimuli are given, they lead to dominant, they come to the surface and they show their signs and symptoms. All right. So it's not the knowledge of the disease which is very important to us. It is the underlying processes which are happening in the body are more important. Therefore, there is a long conception that homeopaths don't believe in the disease. Homeopaths do believe in the diseases, but at a very micro level. Right. So that is what is. Now, what I have told you are classified as if they are watertight compartment. It is not like that in practice. If we have overlapping. We have psora symptom and psychosis symptom and syphilitic symptom, psoric symptom and syphilitic symptom, or the tubercle symptom, or all combination. But fortunately, the God is kind. One miasm is always dominant. It helps to point out the correct remedy. You have permutation combination of these miasms, the signs and symptoms at the level of mind and at the level of body, and its sequential relationship. All these are had to be taken care of in while prescribing in chronic diseases. That's why Hahnemann emphasizes that you have to take time to understand chronic diseases and take suitable remedial action. I think I have covered the miasm adequately. It is something like Dahad's diagram, the cartoon. I have given you the umbrella without the cloth, but then I think if it stimulates you to go more deeper than what I have said today, my purpose is solved. Thank you very much. The time is over, and I think you are all waiting for me to close down. You were very attentive, like this picture. You were not talking, you were only listening to me, I hope. And you have hardly any question. If you have any, please write to me. I will be able to solve if I can. And thank you very much. I have taken you for a ride. I'm sorry. Thank you. Hello. I have finished my lecture, please. Wake up. मनीष खोलो खोलो अभी कैसे अभी कहाँ जाएंगे
Thank you, sir.
Hello.
Thank you, sir. Thank you.
I hope I am not bother or not trouble you more.
No, sir, we enjoyed and you have enlightened us with such a knowledge. So, Dr. Dahad, you are here. I would like you to unmute yourself and say a few words about the session.
Yes, thank you very much. First of all, I would like to thank very short notice he has accepted and in the beginning already yourself has introduced very appropriately. There is actually Arya sir needs no introduction, and he is truly right now the living legend. He is my mentor. I am very much thankful to Arya sir, and very appropriately he has elaborated us how we can interpret the miasm. Things I have been observed in the chatting also. A very good question. Some people they have asked how we can incorporate the miasms, especially is it on the basis of pathology or on the basis of expressions. If I'm not wrong, sir has very appropriately and clearly narrated about it, and he has written certain times we need to take the help of pathology, and that will be very beneficial for us when we are arriving at the miasmatic diagnosis basis of expressions. Sir Hahnemann has very appropriately narrated about this. This is outwardly reflected picture of essence of internal deranged vital force. So no doubt on the basis of expressions, but nowadays many times, as in the present pandemic situations, majority of the cases we are that are very asymptomatic, and this is like that of many of the times we are unable to diagnose the miasms, and that's why at time in present scenario we need to take the help of pathology. I am very much thankful to Arya sir. Arya sir's certain words I remain, and definitely with the kind permission of himself, I would like to share with all of us. This is like that of हम जितना भी बात करेंगे मायाजम के ऊपर उतना कम है. सर्टेन टाइम्स इट बिकम्स मोर एंड मेजरेबल आल्सो. उनका एक शब्द मुझे बिल्कुल अच्छी तरह से याद है. दहाड़, हमेशा याद रखना, 2 होम्योपैथ एक पेशेंट के लिए 3 प्रिंसिपल्स के साथ, दैट मीन्स 2 होम्योपैथ, they are applying 3 principles and selecting 4 medicine for a single patient, and in this way the confusions are going on. But such a type of boosting things, especially from Arya sir, that clears the doubt, and I am very much thankful to Arya sir. I am very much thankful to Gupta sir, Rao sir and Dr Muktinder Singh also. Arya sir, आप सुन रहे हैं? Thank you very much. यस सर, सॉरी अगर कुछ गलत कहा होगा तो. धन्यवाद. थैंक यू वेरी मच.
नो नो प्लीज.
यस सर, थैंक यू वेरी मच. सिर्फ एक क्वेश्चन था थोड़ा सा, व्हाट आई हैविंग पर्सनली, थोड़ा डायबिटीज के बारे में हम लोग मायाजम की तरफ कैसा इंटरप्रेट कर सकते थे, उसमें अगर थोड़ा फोकस डालेंगे तो मुझे भी एज वेल एज ऑडियंस को भी 1-2 सेंटेंस में अगर आप बताएंगे तो बेनिफिशियल होगा, ऐसा मुझे लग रहा है.
ओके. द old onset diabetes is psoric. Juvenile diabetes is syphilitic manifestation. Biochemical diabetes, where there are no symptom but only blood sugar is there, and that too the what do you call blood sugar curve over a period of time it is present, then it is purely psoric. But if it leads to ketosis and all that, or it involves various organs like heart or the liver or the kidney, then it becomes either psychotic or syphilitic or tuberculosis. It then elevates. It all depend on it. So the drug has to be found out in those domain, in those drugs, rather than in superficial small drug where you are treating only the blood glucose and all that. So. But stress diabetes is again a psoric manifestation. Nothing to worry about. During pregnancy, if the diabetes happens, it's a psoric manifestation. But if it persists for a long time, then of course it all depends on what miasm the patient has. It may lead to anywhere complication. Sorry.
Thank you, sir. Thank you.
I hope I have the chemical diabetes is purely psoric, where there is no symptoms, there is no family history, your blood sugar is high, you have to correct only by diet and all that, and a simple anti-psoric remedy will take care of you. But if you are developing ketone body in the urine, and then your urea is going high or your creatinine is going high, then you have to think of either psychotic or tubercular or syphilitic remedy.
Thank you, sir. Thank you.
I hope I've told you about the diabetes. Chemical diabetes, random diabetes has no meaning. Old age onset diabetes has got very good prognosis.
Thank you, sir. Dr. Rosa, you want to ask something? You have raised the hand. Dr. Rosa.
हाँ जी. आपकी आवाज मेरे को सुनाई नहीं.
Yes, sir. Yes, sir. Dr. Rosa from CCRH wants to ask a question. Dr. Rosa, please ask.
Please. Sir, good evening, everyone, sir. Thank you, sir, for such a wonderful deliberation. Sir, this miasm is a very important topic, and the Honeyman, he has discovered miasm.
Thank you.
How this miasm can be scientifically proven, because if you see Ayurveda concepts, bath, pit, cough, and they are doing some Prakriti assessment. But till now, we are not able to develop something like that on miasms. So being a rich experience, clinical experience, how this can be properly established in the most scientific way, and how it is, as Dr. Dahad has rightly pointed out, diabetes is an important non-communicable disease, and it is very challenging to treat. So how we are sure, how we are confident as a clinician to treat diabetes and to manage diabetes? Can we manage diabetes with miasmatic concept, with only homeopathy?
I think so. You will be able to control most of the cases. provided you follow the regime and find out the right suitable remedy for him. If you are not going to find out the remedy, it's not going. What do you think that in allopathy there is a treatment? They just maintain the glucose level. What happened to the what do you call non-specific reactions of the diabetes? They keep on going. Your blood sugar remain controlled, but over a period of time, the shutdown takes place of the kidney. Urea goes, creatine goes, and what you can do? You require dialysis. So you are shifting the disease. Any disease, whether it's a diabetes, hypertension, or malignancy, you have to go into the detail of the past history, the family history, the present, all symptoms, correlate everything, find out which miasm is dominating, try to find out the similar remedy in that domain, and you will be able to succeed. Don't decide miasm only on one symptom. And don't think that one drug has got all the three miasms. All drugs have all polycrests have all well-proved drugs have got all the four domains. All right. You may think it's a psoriatic remedy because your symptomatology of psora is only known to of that drug and not the psychotic symptom, not the syphilitic symptom of that particular drug. So we are not able to do. Sometimes that's why they say that even the small drug can become a similar drug, not the polycrest or not the bold drug which is given in the repertory.
Thank you, sir. But how
one overall view have to be taken into keep.
Thank you, sir.
A juvenile diabetes, you may not be able. Sometimes you will not be able to tackle, and you have to have the resource from the supplement of giving external insulin also. I've seen cases which, if you don't give in time, they may die. All right? So you have to be very careful about. See, ultimately, the patient is more important than your own thinking and your knowledge. Patient is more important. The life is more important, and then you have to see. Okay.
Okay, sir.
Yeah.
Thank you, sir.
I hope I am satisfied. I think your doubts are still lingering.
Yes. Yes, sir.
And I know when we meet in person in the council, we will be able to talk more about.
Sir,
Yes,
it's my request that can we have a special session only on diabetes someday? If you permit, we'll rearrange. If you tell and time us, we would like to hear more about especially diabetes because there are so many patients around us.
Yes, I'll definitely talk about. I'll talk about and correlate with this and then the drug indication and all that. I'll tell. I will be too glad. I'll be too glad.
Dr. Dahad, please be in touch with sir, and whenever he gives us time from his busy schedule, we'll schedule another webinar on the management of diabetes with homeopathy. I would like to have
I think you involve other people also, and then we can have a panel discussion sort of. Yeah, I'll take diabetes, no problem. Like what I have taken miasm today, I'll take diabetes. I will know.
Thank
Whatever
you, sir.
little knowledge I'll share with you all. No problem. Thank you very much.
Sir. Thank you, sir. Now I will ask Dr. Tanvir Hussain to give a vote of thanks on behalf of IIHP. So, Dr. Tanvir, please.
Thank
you. Very much, Dr. Muktinder Singh. First of all, I would like to thank respected Dr. MP Arya sir for his wonderful presentation. It's always a great experience of learning from him. Whenever I listen to him, I learned many things from Dr. MP Arya sir. Sir, thank you very much for your great enlightening presentation on miasms. Thank you very much. And sir, before...
Thank you,
Sir, there is one question from me before putting my vote of thanks. Sir, as you told in your lecture that Dr. Harriman has told that nobody, including myself, is free from psora.
Yeah. You read chronic disease, first part. First part, chronic diseases, first part. First part
Right,
of the
sir,
chronic diseases.
Which edition, sir?
First edition, first part. Theoretical part. I'll give you the cutting if you want. Yeah.
Right, sir. I would like to get that because if we read Dr. Staff letter, Dr. Honeyman has written one letter to Dr. Staff on 14th of January 1828.
Actually, I'm telling you, the theory was propagated in 1828, but during 1800 and I think 17 or 18, he called staff and he called another doctor, Dr. Gross, and shared all his finding with both these people. You go through life and work of Hahnemann by Hale.
Yes, sir. Yes, sir. I will. I definitely love to get that cutting, sir, because in second edition of chronic diseases, again, Dr. Hahnemann says that as is rarely the case, was never psoric, and hence from my birth till now, when I am in my 80th year, I have always remained completely exempt from all the ailments, great and small, described here and there further on. So it was my confusion that in second edition also he says
which edition you are talking about? Which and publication?
Sir, it is a second edition of chronic diseases. If you want this page number, it is page number 57 of German edition and page number 63 of American translation.
Okay. I'll give you both so that you can have.
Yes, but it was because many times I was asked from the seminar point of view also, because he says I was never sorry, though we know that he was died of bronchial catarrh. Yeah, sir. Sir, thank you very much. Thank you, sir. Thank you very much. Thank you. So I offer my vote of thanks to respected Dr. MP Arya sir for his wonderful session, and special thanks to Dr. Muktinder Singh for taking pains to organize all this great event. Today was very brainstorming lecture from Dr. MP Arya sir. I thank our spinal cord of IIHP, respected Dr. V.K. Gupta sir and Dr. M.A. Rao sir, the National Vice President of our body. I thank all the CEC members of IIHP for their presence here. I thank all the audience, all the legends, all the people who are here, given us qualitative and quantitative time. I can see Dr. Dahad sir, who has played an instrumental role to bring Dr. MP Arya sir into this webinar. I especially thank Dr. Dahad sir. Dr. Muktinder was very right that we can listen and we can learn a lot from Dr. MP Arya sir, because he is having a most mature, experienced brain in his body, because we can learn so many things from him. We need a lot of knowledge from sir, as he is a fountain of knowledge. So thank you very much, Dr. Dahad, for bringing him into this platform. I again once thank one and all present here for their presence, for their qualitative and quantitative time they have given us. Thank you once again. Thank you very much. Thank you. Thank you very much.
Thank you. Thank you, sir. I take your leave.